In today's video, I'm going to take you through 5 common mistakes that people make after they've had a knee replacement. And make sure you stay tuned till the very end, because the last one is the most common mistake that I see people make every week in clinic. Hi there, my name is Luke Skembury from Genuine Physio. I'm an advanced physiotherapy practitioner in the UK, and I help over 40s stay healthy and happier for longer. Mistake number 1 is not optimizing your pain relief well enough. Now, if you've had a knee replacement, by now you will realise that it is a very invasive surgery. It involves quite a lot of trauma to the knee joint itself and the surrounding soft tissues, which means that you are going to have a very painful, inflamed, swollen knee after the surgery. Now, the most important thing after your surgery is your rehabilitation. And if you are in too much discomfort in order to do your rehabilitation well enough, then that is likely to slow down your recovery. And a lot of people see decreasing their pain relief as a progressive milestone in their recovery. But if you are decreasing your pain relief and the pain is not manageable, then you're actually going to slow things down. So do make sure that you're optimizing your oral analgesia, that oral medication, so that you can optimize your rehabilitation as your number 1 priority. Mistake number 2 also relates to another perceived progression within your recovery. Now, that is getting rid of your walking aids. So whether it is a couple of crutches, a crutch or a stick, you don't want to get rid of them too early. So what I see a lot of people do is think they're doing really well by getting rid of their walking aid, but they're still walking with a limp. And this is the critical thing as to whether you do or don't need your walking aid. You want to make sure that you have a normal gait pattern, a normal walking pattern before you start weaning off your walking aid. And part of your rehabilitation should involve going through some walking practice day to day. So it might be 5 minutes, 2 or 3 times a day, just to re-educate your whole system and re-educate your brain how to walk again, particularly if you have been limping for quite a prolonged period of time pre-surgery. If you've been doing that for a number of months, then it sounds daft, but you nearly do have to learn how to walk again. And part of that is having support of your walking aid. So mistake number 2 is don't get rid of your walking aid too early. Mistake number 3 is not having adequate support with your rehabilitation after the surgery. We've already discussed that it's invasive surgery. That means that you end up with a lot of different symptoms afterwards, and they are very difficult to navigate by yourself if you've not been through this before. It can be a fairly life-changing experience, and having support from somebody that knows what they're doing is really important. Now, as you can tell from my accent, I'm based in the UK. We have the NHS, and there are a lot of pressures on the NHS, which means that people often don't receive many physiotherapy sessions after their surgery. I'm seeing a couple of patients at the moment in clinic who have had 2 sessions of physio and then they've been discharged because their range of movement is 90 degrees of bend and they can straighten their knee, and that's perceived as doing really well. But there's still a massive gulf between achieving that and then achieving the goals that you want to get back to, whether it be exercise or sport or kneeling or looking after your grandchildren, etc., etc. Having support through that process in what can be quite a long process can be very helpful in terms of making you empowered to know what you're doing and giving you the information that you need to get the most out of your surgery. And that is absolutely vital. You do not want to have a knee replacement and then not get the best out of it because you haven't had adequate support. Mistake number 4 relates to your range of movement exercises. And what I see a lot in people who are doing their stretches or their range of movement exercises after a knee replacement is a big focus on how much bend you can get and not as much focus on how straight you can get it. And that's kind of understandable. I think the reason is there's more margin to get more range in the bend, and there's less tangible, visible range to gain when you extend your knee, if that makes sense. So you might be -5 degrees off getting your knee completely straight, and therefore you're trying to look at a degree or 2 in change, and even as a physiotherapist that is very difficult to do. So It's really important that you don't neglect the extension. The reason that is so important is because you cannot walk normally unless you have a straight knee. So every time that your heel strikes the ground, your knee should be completely straight, and if it isn't, you will be walking with a limp. So mistake number 4 is make sure you do not neglect getting that extension back as quickly as possible. Mistake number 5, which, like I said at the beginning, is the most common one that I see, is not optimizing your strength and conditioning exercises to the point where it reflects the goals that you're trying to achieve. So if you have been given some exercises, if you have a booklet with some exercises in, those exercises where you are lying down, you're tensing your thigh muscle, you're bringing your toe towards you and you're straightening your knee, they are fine for the first week or 2. But you need to be progressing pretty quickly onto functional exercise, functional movements that you need to be able to do day to day, like getting out of a chair, like getting off the floor, like using the stairs. Your rehabilitation needs to look like the things that you want to get back to. Possibly at a regressed level initially, but with a view to building up to the point that you are back to what you want to be doing. And what I see a lot of is you doing the basic strength exercises, and then you increase your just day-to-day activity. So you're doing longer walks, you're using stairs, you're trying to get back to the things that you wanted to do, and then things just get sore elsewhere. I'm seeing a patient at the moment who's got hamstring tendinopathy because they haven't done a good enough strength and conditioning program. They're going for longer walks, they're walking up hills, and because those muscles have not been conditioned to tolerate the load that this lady is trying to put her legs through, she's ended up with other injuries as a result of an inadequate strengthening program. And there is a lot of nuance to a strengthening program. You need to make sure that it's appropriate for your level and symptoms. You need to make sure that it's challenging you. You need to make sure that you're doing it frequently enough during the week. You need to make sure that it's progressed over time. You need to make sure that you're doing it for an adequate period of time. And trying to do all of those things alongside pain is a real challenge, and it kind of goes back to the mistake I was talking about earlier in terms of having some support with that, because there's a lot going on and there's a lot to get right. And fundamentally, if you do want to get back to the things that you were hoping to, then making sure that you have a really robust strength and conditioning program is absolutely vital. So to quickly recap, it's all about making sure you're optimizing your rehabilitation so you get the most out of your knee replacement. So make sure you keep taking that pain relief so you can do your exercises. Don't get rid of your walking aids too soon. Really hone in on getting that extension back in your knee so that you can walk normally again. Ensure you've got adequate support because it is a challenging recovery, and make sure you've got a robust strength and conditioning program that meets the requirements of the activities that you enjoy and love. So I hope you found that helpful. If you would like a bit more bespoke, personalised help, then I do offer one-to-one appointments. You can find out how to book one of those in the description below the video. If you want some harder strength and conditioning exercises, then I have done some knee strength exercise videos on YouTube. You can find them up here. And whilst you're doing that, I'll see you in the next one.